but it is believed to be due to a combination of factors such as abnormal muscular contractions in the intestine, changes in the gut microbiome, and increased sensitivity to certain foods or stress. IBS affects approximately 45 million people in the United States alone, and women are more likely than men to develop the condition. However, the reason for this gender disparity is not entirely apparent. Some research suggests hormonal differences between men and women may play a role. In contrast, others propose that women may be more likely to seek medical attention for digestive symptoms than men. Regardless of the cause, IBS can be a challenging condition to manage, as it can cause a variety of uncomfortable symptoms such as abdominal pain, bloating, constipation, and diarrhea. However, with the proper treatment and lifestyle changes, many people with IBS can manage their symptoms effectively and lead everyday, healthy lives. But scientists are steadily peeling this proverbial onion, with newer treatment approaches targeting pathways that appear to be involved in the cramping. Bloating, gas, diarrhea, and constipation disrupt patients' everyday lives. Researchers and clinicians are actively investigating new treatment approaches for IBS that target the underlying mechanisms of the condition. Some of these approaches include: 1. Dietary modifications. Certain foods or food groups may trigger IBS symptoms, so some people find relief by avoiding or limiting these foods. Examples include fermentable carbohydrates, FODMAPs, gluten, dairy, and caffeine. 2. Probiotics. The gut microbiome may play a role in IBS, so some people find relief by taking probiotics or other supplements that promote healthy gut bacteria. 3. Medications. Several medications have been approved for treating IBS, including antispasmodics, laxatives, and drugs that target specific receptors in the gut. 4. Psychological therapies. Because stress and anxiety can exacerbate IBS symptoms, psychological therapies such as cognitive behavioral therapy, CBT, or hypnotherapy may be helpful for some patients. 5. Newer treatment approaches. Researchers are also exploring newer treatment approaches for IBS, such as drugs that target specific neurotransmitters or inflammatory pathways in the gut. Overall, the goal of these treatments is to improve the quality of life for people with IBS by reducing the frequency and severity of symptoms and helping them better manage their condition over the long term. Marked by chronic belly pain and altered bowel habits, IBS is categorized into 3 types according to which symptoms dominate: diarrhea, IBS-D, constipation, IBS-C, or a combination. It's one of the most common gastrointestinal conditions, affecting up to 15% of Americans, according to the International Foundation for Gastrointestinal Disorders. Yes, that's correct. IBS is categorized into 3 subtypes based on the predominant bowel habits. 1. IBS with diarrhea, IBS-D. This subtype is characterized by frequent episodes of diarrhea, loose or watery stools, and urgency to have a bowel movement. 2. IBS with constipation, IBS-C. This subtype is characterized by infrequent bowel movements, hard or lumpy stools, and difficulty passing stool. 3. IBS with mixed bowel habits, IBS-M. This subtype involves a mix of both diarrhea and constipation, with alternating episodes of each. According to the International Foundation for Gastrointestinal Disorders, IBS is one of the most common gastrointestinal conditions, with an estimated prevalence of up to 15% of Americans. The condition can disrupt a person's daily life, causing chronic abdominal pain, bloating, and altered bowel habits. However, with proper diagnosis and management, many people with IBS can manage their symptoms effectively and lead entire, healthy lives. IBS is what doctors call a functional bowel disorder since it affects the way the digestive system works but isn't due to any apparent structural problem. But that label is problematic, Harvard experts say. IBS is classified as a functional bowel disorder, which means that it affects the way the digestive system works without any apparent structural abnormalities. However, the label functional has been criticized by some experts as being problematic. One issue with the term functional is that it implies that the condition is not real or is all in a person's head. This can be frustrating and stigmatizing for people with IBS who may already be struggling with the physical and emotional toll of their symptoms. In addition, recent research has shown that there may be structural and physiological differences in the gut of people with IBS, such as alterations in gut motility, inflammation, and the gut microbiome. These findings suggest that IBS is not just a functional disorder but a complex condition with multiple underlying factors. To address these issues, some experts have suggested using the term disordered gut-brain interaction instead of functional bowel disorder to reflect the complex nature of the condition better and reduce stigma for people with IBS. Matthew, a cancer and stroke survivor, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.